My journey to becoming a nurse was a bit of a roller coaster. Graduating in May of 2020 with my ADN was a major milestone I had been working towards since 2011. I was relieved to know I was finally able to start my lifelong career goal in nursing. My first nursing job was a long-term care/rehab facility, which I started in June of 2020, although I didn't take my NCLEX until August. This environment taught me valuable time management skills with having 20 to 50 patients to care for. I learned to not be afraid to contact the doctor if my assessment of the patient needed an intervention. The nursing home had an outbreak of COVID, and I spoke up about patient safety and ways of containing the spread of the virus throughout the facility. I lived alone, and unlike most of my colleagues, so I volunteered to work the COVID unit. This meant I cared for 1 to 4 patients myself with no extra help. This makeshift unit was walled off with plastic dividers with no way of communicating to others in the facility except by calling out through the plastic tarp and then waiting for someone to respond, which didn't elicit a quick response. I learned to assess my environment and stock supplies at the beginning of my shift, or make a list for supplies for the oncoming shift to have stocked in the morning. I learned to cluster my care to aid in my patients' sleeping and to conserve their energy. Next, I was hired on at Duke Urgent Care Respiratory Care Clinics. This was an urgent care that only saw moderate to severe COVID-like symptoms in patients who already tested positive. This job enhanced my PPE donning and doffing skills. I was able to work in the lab and run samples, which to my surprise I thoroughly enjoyed. I learned to triage my patients via the phone prior to their appointment to assess if it was the right clinic for them to go to. This was also the first time I was able to work on my IV start skills. Ironically enough, when we were sending a patient to the ED, I got the IV placed no problem, but if it was a non-emergent and for rehydration, I usually missed it. I was able to perfect my lab draw skills and the order of the tubes to be collected in, as well as how to assess for a superior vein to stick. Once the RCCs were converting back to regular urgent cares, I transferred to ICU. This was my ultimate goal that I wanted to achieve by the end of the year. I was so proud to have reached this milestone 8 months early in April of 2021. Working in the ICU for about a year and a half now, I still feel like there is so much I still need to learn. When I look back to where I started, I have come so far. I now know how to use arterial lines, CRRT machines, Cheetah and Argos cardiac monitors, and manage ventilated and sedated patients with confidence. I have gained experience with chest tubes, lumbar drains, paralyzed patients that need to be supinated and proned. I have become confident in my skills of assessing and trending vital sign patterns and titrating drips accordingly or communicating with my providers about other interventions. Recently, I have enhanced my skills as a preceptor. Next will be to train as a charge nurse and then rounding nurse. I take pride in providing safe, efficient care that is tailored towards my patient's specific needs. For these higher level roles, I need the expanded skills and resources that having a bachelor's degree will provide. The baccalaureate nurse possesses leadership skills I will need for these roles, enhanced assessment, and extensive knowledge of the functions of the bodily systems to understand interventions provided to my patients on a deeper level. As a baccalaureate nurse, I will be able to implement and educate my patients and fellow colleagues on new evidence-based practices as well as health promotion. These skills will not only enhance my abilities towards my colleagues, but my bedside assessment skills, health promotion concepts with my patients will improve, as well as my capabilities of communicating with my providers. Having my baccalaureate degree will open the doors for higher level roles, as well as allow me to continue to expand my identity as a nurse.